maneuver test. Patient is going to be supine with their heels off the end of the table. Good, thank you. I'm going to hold the feet of the patient and place thumbs over the medial malleoli while providing slight traction to the legs. And I'm going to instruct him to flex his knees and hips onto the table and then bridge up. So basically, this is going to be what we like to call the hip clearing maneuver. So I'm going to grab Scott's legs like this. Go ahead and bend your legs up. Tell him to do this. I'm going to apply a little bit of pressure here. I'm going to tell Scott to bridge up, lift your butt up, and come back down. That is called the Weber bar style. That's all it is. And then we're going to move to the sit supine to long sit test. So it's the same thing. I'm going to have the patient in the supine position. I'm going to clear the hips, which is doing Weber bar style. So I'm going to do the same thing. Bend your knees. Bend them together, Scott.
What?
Scott, keep your legs together.
Oh.
Thanks, Scott. Okay.
I'm sorry. I'm sorry.
Notice my eyes were at the ceiling the entire time. Okay, let's clear our hips, Scott.
You said.
Let's clear our hips, Scott. Lift your pelvis up. Thank you. Put it back down. And then I'm going to go ahead and pull his legs out here and tell him to sit up. And I'm going to look at the position of his malleoli. So if you look at my thumbs, which you guys can't see over there, they're a little bit off. They should be the same. This a little bit of difference right here is not necessarily a problem.
You can see it on its feet.
So yeah, it's not that big of a problem
Like this one's
because
going down?
it's not more than 1/4 of an inch. So we can do this real quick again. Go ahead and lay down. We're going to bend up, bridge up, back down, and pull his legs back out. And then sit up. See, now that one, he set him normal. We cleared his hip, and now he's good. Okay? All right, so now the supine true leg length discrepancy test. We're going to have, lay the patient supine again. We're going to clear the hips, so go ahead and do the same thing. Knees up, bridge up, back down, and then I'm going to extend both legs. And what I'm going to measure at this point is the top of Scott's ASIS right here, and I believe it's medial malleoli, to the lateral malleoli. So I'm not going to tell you, you guys don't have to get out and take measure at this point, but I just want you to tell me you're going to measure from his ASIS to the lateral malleolus. So that's that bump on the outside of the ankle. Okay?
What does it mean when you're saying like clearing the hips? Like what does that
That
mean?
movement, it's making everything in neutral.
Okay.
Clearing the hips puts everything
Do I
in
need to
neutral.
take my shoes off or do I need to get them on?
No, you're good right now.
Okay.
Okay. Athlete, this is the clinical discrimination between femoral and tibial leg length discrepancy.
Whoa.
I know, it's a long name. We'll be all right. So athlete is laying supine with his hip flex to 45. Okay. And knee flex to 90. Both feet are lined up next to each other. Line them together. Medial malleoli and the MTP joints should be very close to each other, so they're right there. I'm going to have examiner holds the athlete's feet on the table, instructs him to bridge up, and then come back down. So now I'm gonna look at the side. I'm gonna be looking at his tibial tubercles right here and tell him to do the same thing, and then go back down. And we're just looking at the tibial tubercles at this point. And then I would be going and telling him to do the same thing, and we're gonna look at his patellas this time, okay?
What are you looking for?
We're looking to see if there's a difference between the two.
So is a lot of these tests like them doing it and you watching?
Some of these, yeah, but we're gonna start getting into the more hands-on stuff here soon. So Gaines-Lens test is patient is lying supine close to the side of the table, so scoot towards me, Scott. I'm gonna let this leg hang off. This table's a little short, so we'll be all right. And I'm gonna instruct the athlete to actively flex this leg and hold it to his chest. Yep, right. And then this is where he's not gonna like it, so Scott, it's okay if you cry on this one.
Alright.
Okay. I'm gonna push down right here. If he's over a little bit farther, scoot your butt this way. There we go. All right, so you kind of want his butt cheek hanging off, and you can push down like that, and he should feel a stretch on that. Should feel kind of good.
Yeah, it does feel good, but like my foot's like in the ground.
Yeah, so if we were on a taller table, we're gonna push down. His foot wouldn't be touching the ground, but that's for SI joint pain. So, and it's also a really, really good stretch for the quad. Go ahead and scoot back over. All right, athlete is seated with knees over the edge of the table. I'm gonna place my forearm or something underneath his mid-thigh and the other hand to push down his anterior thigh. This is called the fulcrum test. So basically what I'm gonna do is I'm gonna lift Scott's leg, push it here, and I'm pushing down on the thigh. Yeah, it feels great on my arm too, by the way. So, that's for a possible femoral stress fracture, because if you think about it, we're just applying a whole bunch of pressure right there. Hip scouring test. Go ahead and lay back down. The examiner is going to fully flex the hip and the knee. So we're gonna bring this as far up to your butt as you can. Okay? And then we're gonna apply downward pressure along the femoral shaft while we're repeatedly internally and externally rotating the hip in multiple angles of flexion. So we'll probably do one at a time, so go ahead and let that one out. So we've got his leg all the way up here. I'm gonna turn him this way. That was your knee. Turn him this way and this way. Then we're gonna go this way, and I'm still pushing down and turning him in and out, and go this way, in and out. And that's hip scouring, because you're literally shoving the femoral condyle into the hip and you're moving it from side to side. So you're scouring that hip joint. SI compression test. Examiner is going to apply, or he's got to be supine, and I'm going to apply pressure to the ASIS. Remember, ASISs are the tops of your hips. So you can do it like this. I'm just going to literally grab the top of Scott's hips and push down. Some people do it this way, but I just do it this way.
I feel like that would feel good. I feel like that would pop my back. I don't know why, but I feel like it would.
So you just push down. SI distraction test. I'm going to have him sideline, so face Grace. Examiner is positioned behind the athlete with both hands on the lateral aspect of the pelvis, and I'm going to apply a downward pressure up through the anterior portion of the ilium. So basically, I'm going to go on the side of his hip and like do CPR on his hip. I'm going to try to open up the SI joint. Okay?
Oh.
He did get Scott. Piriformis tightness. Athlete is sideline.
Why'd you move, Scott?
I know, I didn't tell you move. All right. The leg we're testing is going to be this one. It's going to be on top, okay? Athlete's test leg is flexed to about 60 on the hip. So we're going to go just a little bit out, and the knee is flexed. And what we're going to do with this one is we're going to push down.
Ooh.
And IT band tightness, piriformis pain.
I was about to say,
So
I ought to stretch your IT band.
he will feel this one if he's as tight as he says he is, which he is. 90-90 straight leg raising. Athlete is supine. Hips and knees both flex to 90, so lift your legs up off the table, like this. Put the other one up that way too. Thank you. Athlete is going to grasp behind his thighs and stabilize the hip joints, just like so. And then I'm going to have him actively extend his knee. So go ahead and, no.
Like that?
Yep. One each time. There you go.
I can tell. Oh my gosh.
Okay?
Not good.
So
No
this test is for hamstring muscle tightness.
I'm tight.
I'm sure I have that one.
The Ellie's test, I'm going to have the athlete prone with knees extended, so prone.
Prone is on your belly.
This one's really, really easy because all I'm going to do is I'm going to grab his foot, I'm going to flex his knee, and I'm looking at his hips. So Scott had like no movement. That's good. If you have tightness, you're going to see a hip hike up right away as soon as I start flexing this foot. And so he's just got a little bit of movement, which is what we want. But you don't see his hip really flying up. Granted, he's got a big old jersey, so
Oh.
we're gonna just do your shirt right there. How many layers do you got on? It's like 90 degrees outside, Scott.
Stop, it's part
No,
of the
you're fine.
thing.
You're fine. Just stay with that. I just need to see the T-shirt. So now we can kind of see. There you go. See, his hip doesn't really move. You don't see a lot of movement in the hips. So